So, you've had COVID-19. Maybe you even thought it wasn't as bad as the media has been making it out to be. You might have felt a little under the weather for a little while, or lost your sense of taste and smell for a few weeks. But now you feel fine. In that case, you might be forgiven for thinking that now that you're full of antibodies, you shouldn't need to get vaccinated against COVID. Right? Wrong. In fact, the Centers for Disease Control and Prevention definitively answers this question on its frequently asked questions page, where it reads, "Yes, you should be vaccinated regardless of whether you already had COVID-19. That's because experts do not yet know how long you are protected from getting sick again after recovering from COVID-19. Other medical experts cite the variants spreading around much of the country as another reason to get vaccinated. Dr. Becky Smith, an infectious disease doctor at Duke University Hospital, told CNN, "We are not sure if natural immunity will protect someone from getting infected with the new strains." Meanwhile, Dr. Antonio Crespo, director of infectious disease at the Orlando Health Medical Group, told the outlet, "The risk of reinfection remains low, but we have to be vigilant with the emergence of the new variants." Although there is consensus that natural antibodies developed from infection do offer some protection against COVID-19, vaccines certainly offer better protection. For people who exhibited no symptoms or just mild symptoms when they had the virus, antibodies also may disappear faster. As UCLA reports, in people with mild cases of COVID-19, antibodies against SARS-CoV-2, the virus that causes the disease, drop sharply over the first 3 months after infection, decreasing by roughly half every 36 days. Dr. Becky Smith also told CNN that the vaccines can offer something like a top-up to those who had a mild or asymptomatic case of COVID-19. She explained, "It is very clear that the two available vaccines afford a high level of protection as measured in neutralizing antibody titers. This may be particularly important for people who had an asymptomatic or mild infection. It is also recommended that people wait until they are no longer experiencing COVID-19 symptoms before receiving any of the vaccines. Also, if you had COVID-19 and were treated with monoclonal antibodies, you should wait at least 90 days before getting vaccinated." Meanwhile, unsubstantiated reports have circulated to suggest that those who had the virus only need 1 dose of the Moderna or Pfizer-BioNTech vaccine. But Dr. Smith told CNN that not enough research has been done to determine whether 1 shot is enough. As such, even if you had COVID-19, you should keep to the 2-dose regimen. Pfizer recommends both doses should be taken 3 weeks apart, while Moderna recommends 4 weeks. And then there are the side effects. While minor side effects can occur after any vaccination, the COVID-19 vaccine side effects have attracted much attention in the media. The most common side effect is a sore arm, which is usually felt around 24 hours after receiving the shot. You may also feel like you briefly have the flu, with many of the symptoms overlapping with a relatively mild case of COVID.
The day that I got the shot, my arm got pretty sore. And then the next day when I woke up, I just had some kind of general fatigue.
These symptoms can include a headache, fever, chills, muscle aches, and occasionally nausea or diarrhea. If you have already had COVID, you are more likely to experience side effects from the first of the 2-dose vaccines, while people who have not had COVID tend to feel more side effects with the second. Of course, some people, whether they have had COVID or not, end up with nothing but a sore arm. Either way, the risk of coming down with these relatively mild side effects should not deter anyone from getting the vaccine. As Dr. Thomas Campbell of UC Health University of Colorado Hospital explains, everyone should get their vaccine as soon as it is offered to them. Getting the vaccine is the best way to protect yourself against severe and potentially life-threatening illnesses from COVID-19. Check out one of our newest videos right here. Plus, even more Health Digest videos about the latest vaccine developments are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.